Hi, Dr. Robinson. How are you doing today?
I'm doing good, Dr. Underwood. How are you doing?
I'm doing great, and I'm so happy you came in today because I wanted to discuss a patient with you. They're wanting to increase their home opioid use, and I'm a little concerned about it. So I was wondering if you could help me encourage them to use some of those multimodal therapies instead.
Oh, I'd be happy to. Have you ever thought of doing motivational interviewing?
I have, and I don't feel like I know enough about it to actually implement it into practice.
If you have the time right now, I can walk you through some of the steps that I use for motivational interviewing and maybe give you a few examples.
Yeah, that'd be wonderful.
Oh, perfect. So the first thing that kind of comes into play is asking open-ended questions. And so for your patient who is interested in increasing their opioid medication dose to handle increased pain, an open-ended question might be, so it sounds like your pain is increased. Can you tell me a little bit about your pain? And so that they have to tell you exactly what is happening with this pain and when are they experiencing it. And so a lot of kind of maybe clarifiers added on to that open-ended question. And then after you kind of get to that problem with that open-ended question, the next piece I usually like to kind of add in is some sort of affirmation so that they know I heard them and that I'm complimenting them for sharing so that they feel comfortable sharing even more. So I really appreciate you taking the time to share with me about your pain and telling me a little bit more about it so I better understand. After that, I usually validate kind of what they've shared so that they know I've heard them, I notice what they're doing, and I notice that they've come to me. So for your patient, maybe saying something like, I'm so glad you came to me before just increasing your dose so that I could better understand how I could help you treat your pain. So it's noticing that they're taking the initiative so people feel that they're being recognized. Then I usually reflect and usually share back exactly what they've shared with me so that they know that I'm listening. And it's this constant kind of listening feedback loop. So providing that kind of reflection. So it sounds like I heard. And then after that, I really encourage some sort of personal exploration, really having them share exactly what they're experiencing and how they've managed that. So tell me a little bit more about what you've done for your pain and how that's impacted you. And so not just necessarily sharing, but the decisions that they've had to make or the decisions that they are making so you could better understand exactly how they see their pain. And so sometimes it might be the difference between this idea that they think maybe their pain should be at a 0 out of 10. And you know that they're never going to get at a 0, but at least it gives you this idea of what their expectations are. And then kind of this almost last piece is really this pointing out discrepancies. So say they shared with you something that doesn't necessarily isn't in line with increasing their dose. So maybe they shared with you that they have constipation or that they're struggling with insomnia or difficulty staying awake during the day because they're tired and lethargic. So it's really this idea of why wouldn't pain medications be the appropriate thing for them? So it's kind of helping them see it, not you telling them, but you highlighting, oh, it sounds like, constipation is a problem for you. Well, if we increase your dose, that's actually going to be even more. Or it sounds like you're struggling staying awake at work already. If you're not able to stay awake at work, what effect would that have on your life? And could that potentially put you at risk of an injury? So it's really kind of making sure that they understand how that relates. And so kind of with that, after I've kind of identified some of those discrepancies, I really summarize kind of what I've heard. So it sounds like you still are having pain. The pain is significant, that you've tried X, Y, Z, but it's not necessarily alleviating the pain, and that you want to increase your dose of medication, but it may not be the best thing for you because of constipation, because of increased drowsiness. So it's really kind of summarizing all the discussion that you've had and then potentially some solutions that you've come to together. In this case, it might be adding adjunct therapy or something else. And so it's really kind of helping to kind of close that loop where they come to that decision. And so I think that it should be a natural thing for you because you're a great listener and you ask lots of questions. And so I would just open up that kind of opportunity for people to share.
Okay, yeah, that sounds great. Thank you so much for the tips. Yeah, if I have any additional questions, where should I look for some resources?
Actually, I have a little sheet that I keep on my board all the time so that when I'm talking to patients, I can kind of look through and see, have I covered all those pieces? And then there's also my card as well. So if you'd like, you can always call me and I can kind of walk you through any, sometimes some patients share a little less. And so it might be looking at different prompts that might have worked. So I'm always happy to share. But this way, at least you have a starting point that you could say, did I ask them the open-ended questions? Did I, find and point out those discrepancies? And did I summarize to them what maybe options would be?
Okay, this is great. I definitely feel a little bit more comfortable. Appreciate you coming today.
No, thank you so much. And if you have any other questions, please feel free to give me a call.
Okay, sounds good. I look forward to speaking with you in the future.
Thanks. Have a wonderful night.
You too. Bye.
Bye.